Hi, everybody. I'm Jackie Womble with Health and Wellbeing with Sodexo. Who in here has ever heard of Sodexo? Ah, nice. We typically, anytime I give talks like this, and sometimes nobody raises their hands, and we're often the largest company that nobody has ever heard of. So let's see here. Well, is there a clicker? Or? It's okay. That's all right. I'll just stand right here. That's fine. Oh, here we go. Okay. So we are a quality of life services company. And what does that mean? We provide a lot of various services. We provide over 100 different services, actually. You guys might know us best for our food services or facilities management. We are a global company located in Paris, France, where we do things like landscaping the Eiffel Tower and that whole area to managing hospital food for the patients and the guests. We work in Fortune 500 companies, government, school districts, college universities, and offshore oil rigs as well. And it is our mission to improve the quality of life of our employees and all that we serve. And just to give you an idea of our landscape and how large our company is, we staff over 131,000 employees in North America and close to 430,000 globally. We're in 80 different countries, and we touch 100 million people daily. And so it's a huge opportunity that we have as a services company. And I want to share all of this with you because it's good to know, of course, what the company does, but you're probably wondering, how does telehealth play a role in our services company like this? And it's important to note that we are also one of the largest employers for registered dietitians. And with this, we have our commitment to for a better tomorrow. It's our corporate responsibility commitments that we have that we value and we live out every single day. And our team is specifically focused on improving the quality of life of our employees, as well as encouraging our consumers and improving access to healthy lifestyle choices. And so that's what we're going to dive a little bit deeper into. And so whenever we meet with clients, as well as our own employees, all employers, they want long-term change. They want job satisfaction. They want to reduce absenteeism, presenteeism. They want healthier employees. And of course, we serve food to them most frequently, and that's usually when we get in the door with a lot of these large corporations, hospital systems. We're talking to them about how can we expand our services to help address and align our strategy with our clients' health and well-being strategy. How can we improve the quality of life of their employees as well? And it always comes down to how can we help with long-term behavior change? And so this is where telehealth comes in. We provide a variety of different nutrition resources and services, specifically in healthcare, but also in our corporate settings, as well as schools and universities. You think of from a patient perspective, they just got admitted to the hospital. Maybe they had a heart attack. Maybe they were, diagnosed with diabetes when they were there. So our dietitians will get called upon to do education. Many physicians and nurses in the room will understand how this works. They get called upon, they have to go to the patient's room, and they do education on how should you eat whenever you're diagnosed with diabetes? How should you eat heart healthy? Well, these guys just got diagnosed with diabetes, or they just had a catastrophic event and had triple bypass surgery. They do not want to hear about how they need to change their entire lifestyle right there on the bedside. They're probably, medicated and not really all there. So this is a huge opportunity where telehealth would come in, where this is not necessarily where we're at today, but this is where we would like to go, where our dietitians would be called upon, via telehealth to do these educations. Also, we're not able to change and help guide somebody in long-term behavior change in one visit, especially right after a catastrophic event like that. So the use of telehealth is really important in the follow-up and the convenience of that, just from an education perspective. And so what we have done as a company, we are piloting a few different solutions where we have, sorry, I just got the 5-minute mark, I gotta hurry up. We're piloting different solutions where we're offering diabetes prevention program. We're partnering with companies like Fruit Street, who I think is in the room somewhere. And we're also working on delivering health and well-being solutions where the individual can choose what they need to work on. They can identify the behaviors that they think that they should work on, and then they have the resources to work on it, whether it's a registered dietitian or just a behavior coach that they have access to at their fingertips. The use of technology and telehealth specifically has also helped with creating metrics so we can demonstrate success. Right now, we have internally socialized the idea of telehealth and using it in our clients. We've been asked how can we truly help improve the quality of life of our employees and the clients that we serve. And so we've gotten the approval from our internal leadership, and now it's really selling it and sharing it with our clients and their leadership that this is something that they should adopt. You think about in some of our corporate settings, our clients will hire our dietitians to support their portfolio of work. Well, that's one dietitian that might be located in Kentucky, but they're responsible for the entire portfolio, which is all around the country and sometimes around the world. So how do you expand those resources, expand that reach that person is doing? There's really no solution for it other than something like telehealth and the use of technology. So that was really quick. I will stop there. Does anybody have any questions about what we do and how we use telehealth? Thank you.
Any questions?
Is it still on?
Could you elaborate on the metrics you use to measure your success?
Yeah, so there's a few different projects going on right now where we are measuring the long-term behavior change, and it's all self-reported by the individual on things like their knowledge of their stress levels or their knowledge or the amount of fruits and vegetables that they're eating, reduction in waist circumference, things like that. So we use various surveys that they take, before and after their program to measure that behavior change.
Hi, I love your commitment to wellness, and I was wondering if the strategies that you use for your external clients are used at all internally too, if you have that same commitment with your employees.
Yeah, great question. And that's exactly what we're doing. So we're recently, the last 5 or so years, we implemented a health and well-being program for our internal employees, and it's something that we are also able to sell to our clients as well. If you think about our company is pretty much, it's 100% virtual. We are in the sites of clients around the country and around the globe, but our Sodexo's headquarters, we're in Gaithersburg, Maryland, for North America, and everybody is located, at their client site. So how do you provide resources in a virtual space like that? And so that's something that we have been piloting and implementing with our, right now it's at the manager level, and we're looking to expand that to all of our frontline employees as well would be ideal. So we're working on that too.
There are wellness companies such as Omada Health, and others that focus quite a bit on weight management, smoking cessation, pre-diabetes. Do you consider them competitors, or are you offering something entirely different?
Our approach is absolutely, it's completely different than a company like Omada Health in the sense that we all want to improve the quality of life of the employees, but how we're doing it is completely different. We've partnered with a company called Life Dojo, and they're really focused on that sustained behavior change where it's a person-centered coaching, and it's not somebody saying, hey, you need to enroll in the diabetes prevention program and you need to sit through this 16-week class. It's the individual saying, you know what, I think my stress levels are out of whack and I need to figure out how to do it, so I'm gonna focus on maybe yoga or meditation to address my stress levels, and here is a coach who is focused on teaching me how to do that. Here are resources. I can be rewarded and incented along the way, and then if you find that you need more care and somebody who, they might be wanting to manage their stress levels, but maybe their coach wants to maybe their coach identifies deeper issues, and they could either benefit from a registered dietitian from a nutrition perspective, or they might need something a little bit, more intense. That's where we partner with our clients on the various resources that they have available to refer them out for that.
What's your current engagement with your internal company, with your company that you said you're piloting now, with your corporate? What's your engagement with your company versus the employers that you're working with?
Good
Under
question.
the registered dietitians.
Yeah, so they're two separate programs. Our nutrition services are usually led by our clients, and we're offering that service as something that they can implement at their site. The internal program that we have implemented is our engagement rates are enrollment around 60% and engagement upwards of 40%.
Thank you so much
Yes,
for a
thanks, guys.
great help.